This morning on Today's Health, we're answering the questions you may be too embarrassed to ask your doctor. Well, Dr. Keri Peterson has seen and heard it all. She's here to help us. She's an internist and a contributor to Women's Health magazine. Keri, good morning.
Good morning, Natalie.
Got a lot of great questions, so let me get right to them. And here's one. You're the woman who has seen, she says, can having sex increase your chances of getting a urinary tract infection?
Yes, it can. Sexually active women have more UTIs than women who are not sexually active. And we get them when bacteria go into the urethra and then enter the bladder. Now, women are at higher risk than men of getting UTIs because of our anatomy. We have short urethras, so the bacteria does not have far to travel, and plus, anatomically, the urethra is near the rectum, which harbors bacteria. Now, if you have a UTI, there are certain characteristic symptoms. You'll get frequency, urgency, burning, pink-tinged urine, foul-smelling urine, and pain in the upper abdominal area. If you have these symptoms, call your doctor right away, because if it's not treated, it can go to the kidney and become very serious.
Over-the-counter options are not the remedy.
They are not the remedy. You do need an antibiotic, but I do have some tips for preventing a urinary tract infection. The first is hydrate very well. That will flush the bacteria out of the bladder. The next thing is make sure you always wipe from front to back, never from back to front, just so you don't get bacteria towards the urethra. The next is urinate after intercourse every single time, and avoid any irritating products like any douching or deodorant sprays or powders.
Okay, let's move on to the other embarrassing questions now. I burp all the time. I can't control it. It is especially embarrassing in public. Is there anything I can do to make it stop?
Well, there probably is. Yes, this is definitely a problem. Belching is a release of air from the stomach, and about 7% of the population has severe and bothersome belching. Now, typical causes would be digestive problems, swallowing too much air, having an ulcer, having reflux, or even a hiatal hernia. But sometimes it's triggered by no known reason at all. But if you do have any of these medical conditions, see your doctor, because they can treat it. And I do have some tips for reducing belching as well. So at Women's Health, we recommend a few things, and most of them are related to avoiding swallowing air. Eat and drink slowly. If you drink too quickly, you'll tend to swallow more air. Don't drink out of a straw for the same reason. Avoid chewing gum and sucking on hard candies, because you'll swallow more air. Avoid carbonated beverages. This is kind of common sense. You're swallowing bubbles. It releases more air into your stomach. And then lastly, don't smoke. Yet another reason not to smoke. When you inhale, you can swallow air. Okay,
good to know. Okay, next question. I think a lot of people have had to deal with this, is earwax buildup. This person writes, I frequently feel blockage in my ears from wax buildup. How can I treat it? Is this something that you can treat at home?
Well, it is common, and it is something that you can treat. Earwax is made in the lining of the ear, and it actually does serve a purpose. It helps protect our ear from infection, and it traps dirt. Now, if you have earwax buildup, some of the symptoms you may experience are decreased hearing, fullness in the ear, ringing in the ear, and pain. There are over-the-counter drops that can soften the wax and help it sort of make its way out of the ear on its own. But if you try them and they don't work, please do not put anything in your ear to try to dig it out. No finger, no cotton swab, no bobby pins. People use all sorts of strange things because the eardrum is very, very fragile, and it can rupture. So see your doctor if you can't get it out on your own.
Okay, now here's another one. Can you get a yeast infection from exercising? True or false?
That is true. You can get a yeast infection from exercising. Yeast infections are from an overgrowth of a fungus called Candida, which naturally lives in our body and thrives in moist environments. So you can also not only get it vaginally, you can actually get it in skin folds like the armpit or under the breast. Now, exercise increases the likelihood because we sweat. And when you sweat, it creates a hospitable environment for the yeast to grow. So if you're exercising, a few tips: wear breathable clothing, shower right away, and dry off very well. There are other causes of yeast infections. Wearing non-breathable fabrics will make you predisposed to getting it, because you do, again, build up moisture. Stress, being pregnant, having uncontrolled diabetes, and taking antibiotics all can set you up for yeast infection. Now, symptoms that you may experience: burning, itching, stinging, redness, and a thick white discharge are all signs that you may have one, and there are over-the-counter treatments available, and many women will opt to treat themselves because the treatments are very effective. But I do want to give a word of caution that not all infections that itch are yeast infections, and a study did show that 33% of women who are self-treating are mistreating themselves. So if you try one of these over-the-counter antifungal creams and it's not working, go see your doctor.
All right. Dr. Keri Peterson, great segment. Thanks so much.
Thanks, Natalie.